this scenario, a 10-year-old girl has been diagnosed with a malignant brain tumor, which has progressed despite treatment. Her prognosis is grave. Her mom and dad are meeting with a pediatric oncologist and a social worker to discuss the goals of care.
Hi, Maureen and Cliff. I'm Marcia, and I'm one of the social workers that works with Dr. Cedarquist in oncology. Hi, Marcia.
How are you doing today?
Okay.
A little better.
Well, we wanted to have some time to sit and talk with you, and I wanted Marcia to come and meet with us as well about how things are going with Dakota.
Are there any hobbies or activities that Dakota's still able to enjoy doing?
Yes, she's still able to enjoy playing with her Wii and having friends over, that sort of thing.
What's your understanding of her condition at this point? What's been explained to you so far?
Well, she's had several rounds of chemo, and she doesn't appear to be getting any better.
Okay. So she's not looking better so far, and her illness has progressed despite treatment. And unfortunately, at this point, we have maybe one more treatment option, but basically it's not going to be curable. And this cancer will progress.
What can we expect as far as length of time? How long does she have?
Yeah. Well, it's always hard to predict very specifically within one individual, but on the average, it's about 6 to 9 months would be typical. I'm afraid we don't really have any real effective treatment options left.
What's her life going to be like?
What can we expect?
As the disease progresses, she's probably going to get weaker and probably be spending more of her time in bed, resting. She's probably going to feel less and less like eating. Her appetite will probably kind of taper off, and eventually she'll just go to sleep at some point in time and not wake up. And eventually her breathing would slow down and she would just stop breathing.
Is she going to be in pain?
Fortunately, with this kind of cancer, there shouldn't be a lot of pain. I know she gets some mild headaches that we've been treating with some pain relievers she can take when she needs it, and that seems to have been working. That shouldn't get a lot worse. I'm worried that if we did try more treatment at this point, that she would have a really hard time tolerating it.
The last round of chemo.
Yeah.
She hates chemo.
One of the options at this point for her and for you is to shift her care to focusing on keeping her as comfortable as possible, focus on keeping her symptoms under good control, and shift towards improving quality of life rather than trying to continue to treat this cancer.
Has Dakota talked to you at all about what she would like? What she is important to her?
She hates being in the hospital, so she'd rather be at home.
She had a hard time tolerating some of the treatments she's been getting.
Well, that, and she just doesn't like being away from home. I think when she feels bad, she'd rather be with, people that she knows and in her room and with her pets. And
yeah. Based on her wishes and what we've talked about today, so I think it's important to document that for the future. One of the tools that we have now to achieve that is a form that's called POLST form. This is a document used here in California along with multiple other states. POLST stands for Physician's Orders for Life-Sustaining Treatments. It allows us to document what patients want as far as their care. So let me go through the form with you and explain what's documented on here. The first section designates whether she would want CPR. And this means, when she became so ill that her heart stopped, that we would want to allow her to pass away naturally rather than having resuscitation efforts, which we know in her condition would not be successful.
So that's like a
So-
do not resuscitate order.
It's a do not resuscitate order. And unfortunately, what happens if people do try to resuscitate patients who are terminally ill, that usually ends up meaning they're getting transported to emergency rooms and put in the ICU. They're not kept at home once that happens.
I don't think she wants that.
She'd really prefer to be with her family at home, it sounds like,
Yeah.
from what we've talked about. So then I would designate no CPR, which is a do not resuscitate order, on the first section. The second section addresses how much treatment she would want if she became ill. Say she got a pneumonia at home, and we had to decide about anything from whether to give her antibiotics to, if she got really ill, would she want to be transported to the intensive care unit, put on a breathing machine.
If it's anything involving returning to the hospital and on life support systems, then no.
Okay. So being put on machines or life
No.
support would be beyond what she would want.
Correct.
So we can designate on here if you feel that she's really decided not to go back to the hospital. We can designate that on the form. All right, and then the third section talks about artificial feeding or nutrition through a feeding tube. Unfortunately, in her condition, patients tend to stop eating towards the end. Some people try to then treat them with feeding tubes, and we've been unable to impact their outcome with doing that, and usually it just causes more side effects, and it's somewhat invasive with having a tube in her stomach, and it's not something
No.
certainly we advise.
Yeah, I don't think so.
So we'll designate on here that she wouldn't want any artificial feeding tubes. So for this to be legally valid, it needs one of you to sign, and then I sign it. And then you always keep this with your daughter. If she were to go to the emergency room or hospital, which hopefully won't happen, you would want to take this with her.
Will there be a copy on file at the hospital?
Yeah, we'll make a copy for her record here too. So if one of you can
Sign it.
Okay.
just sign right here. Okay, and then I'll sign it for you, and then I will make a copy for her chart here and then send this home with you.
Would you like us to go in and speak with Dakota with you right now?
Yes, please.
The PULSed principles that were demonstrated are: PULSed can be used with any seriously ill patient, regardless of age. The PULSed conversation is centered around the patient's values. It may be appropriate to include a child with a chronic, progressive, or terminal illness in the PULSed conversation.